All right, we're going to talk about the supine position. This is where the patient is on their back. There's a few different things that you need to be aware of, that you need to pay attention to. First thing would be pressure points. So all of our patients come with a Meplex pad on their sacrum. So we've got that covered. Usually start at the head. You've got an anesthesia pillow, keeps the head and neck in a neutral position. You've got the arms, you've got arm boards. You want to pad different areas. Make sure the arms are padded, so we're protecting the nerves that run throughout the arm. So we're going arms out with this one. So I've got just pads underneath the arms. Your arm natural position is palm up, facing the sky. Some people are contracted, they're not, they won't lay down perfectly flat. In that instance, we build up the foam to support them. And then we put these little safety straps around them loosely to make sure their arm stays on the arm table. When you're positioning arms out, you don't want to go above 90 degrees. If you go above 90 degrees, you're going to risk a brachial plexus injury. It's a nerve injury up here in the shoulder. You don't want to go above 90 degrees or less. You can also tuck the arms if you need to. ENT cases where they're working at the neck, a lot of times they want both arms tucked because they're going to be all around the top of the bed. Okay. Next thing I want to worry about is as soon as I get them on the bed, I'm going to put a safety strap across them, ideally across the upper thighs, depending on where we're operating. Going to put it on loosely, make sure there's something between the patient and the strap, because our straps are kind of rough. I don't want it to damage the patient's skin. Knees, I've got the knees bent and supported. They're flexed. Got this Jill roll underneath them. Most people are comfortable with their legs flexed. Having your legs flat and straight can aggravate the lower back of a lot of people. So you want to make sure that they're comfortable, because especially if it's going to be a long case, you don't want to aggravate some lower back injury. And then the last thing would be your feet. You want to make sure your ankles are floating. These are nice little gel pads that are made for ankles. They just sit right in, make sure your foot's in a neutral position. If you don't have these gel pads, you could put some foam underneath the heel to float it. You just want to make sure that it's not touching the bed. All right, you want to avoid any type of pressure on the heel, because that's a very common skin wound that people get during their hospital stay. The other thing you want to think about is what kind of surgery you're doing. So what kind of accessories do I need for this bed? Are we doing a bariatric surgery where they're going to be in steep reverse Trendelenburg, which is head up, foot down? So we want to make sure we have a footboard on. And the footboard's pressed up against the feet, but not bending the feet. We want to make sure that's secured to the rails. Maybe we're going to go very steep Trendelenburg, which is head down, feet up, for a diagnostic lap, GYN case, whatever. Sometimes they're in lithotomy and they go steep Trendelenburg. You want to have something that keeps this patient from sliding off the head of the bed. Here we use what's called a pink pad. That's the official name of it. It's a pad that goes directly on the bed, and the patient kind of sinks down into it, and then it has a safety strap that goes across, and also safety straps to the bed. Now let's say I'm doing a case where they want the arms tucked. I'm just going to show you the correct way to tuck one of the arms. Sometimes they'll want both of them tucked. Sometimes they can have one arm out, one arm tucked. Depends on the surgeon. So what you want to make sure you do is you pad correctly and that you're wrapping the arm in the draw sheet correctly. Got a draw sheet under your patient, fold it over your patient, take their arm, goes right by their side, thumb will be in thumbs up, so you don't want your hand down or twisted, in the thumb up position, arms by your side, and you're going to take your foam, and you're going to pad the wrist and the hand. Just going to make a little taco. And then I'm going to pad the elbow and protect the nerves that run through the elbow. Just like this. Ideally, I'll have another person on the other side of the bed. They'll then roll this up to take any slack out. kind of do it with one person right now. Making sure my thumb's up. I'm gonna hold this and I'm gonna go up and over and then under the patient. I'm not gonna go under the bed. I'm gonna go under the patient. Just like this. Now my arm is tucked. Double checking, my thumb is still thumbs up. My pads are where they should be. The draw sheet's not too tight. It's not gonna constrict the blood pressure cuff. I made sure that if they have any IV lines, that they're either all going out the top or going out the bottom, that I'm not gonna pull them out. They're not gonna get kinked. And then throughout the case, I'm keeping an eye on the arms to make sure they don't come untucked, especially if they move the patient around during surgery. So after I've tucked the arms, I take the arm board off, and now the surgeon has access. They can get right up next to the patient when they create their sterile field.